Now, for the uptenth time, the federal government may have again dashed the expectations of Nigerians hoping for a revamped health sector in the year 2018, considering the amount it allocated to the sector in the budget estimate currently presented to the National Assembly. Well, let's now bring in Program Director, Child Health Advocacy Initiative, Lola Alonge, to talk more about this. Thank you very much indeed for coming.
Good, my pleasure being with you today.
All right, well, if the government is to meet all its health programs, do you think that the 340.8 billion naira allocated to the health sector is good enough to do that?
Well, maybe I'll start by saying access to good health care is a human right according to the World Health Organization. And the UNFPA, United Nations Fund for Population, also said something like a woman must not die while giving life. We must give priority to health. When we want to talk about development, economic development, growth, health is like key. When we're talking about the Sustainable Development Goal, achieving it by 2030, health is a basis of all the Sustainable Development Goals. So looking at budget and then the issue of health, if we want to really develop this country, we must give priority to health, like I said earlier, which means the allocation must be good enough. There are too many issues in relation to health. Yes, they are giving preference to like road construction, housing, other areas, but then life and health is key for any nation. So there is no way we can continue to say we don't have enough funds, we have to just give a little bit of budget to health. We must prioritize health, allocate enough budget, because there's so many things to cover. Starting with human resources, the health workers. If you look at the ratio of the citizens, the patients to the doctor, to the health worker, it is very low. A lot of people are dying from preventable deaths. There are a lot of cases the doctors are even on strike. These doctors need to be trained. We also have to look at areas like drugs. There's need for enough drugs in the hospitals. There's need for equipment. I've had a lot of cases, basic equipment. I mean, to maternal and child health, a lot of babies are dying because they don't have enough incubators. We're looking at a situation where even people like someone walks into the hospital and they can't even, the attitude of the health workers is not good enough. So there are so many things. Looking at even immunization, they need to prevent health, not until somebody is not feeling well. They need funding for that.
The clamor for revamping the health sector has been, long overdue and always been said. Why do you think the federal government still fails to give it its priority?
Yeah, like I said, they must give it priority. We have what we call the Abuja Declaration, where in 2001, where all the countries came together and said, yeah, we're going to give 15% budget allocation to health. Unfortunately, we're far from that. And like I've said, it's either the priority is it health or is it not health? And that is why other schemes are being introduced. We had this dialogue on financing health recently in Lagos State, just like a week ago. We have the National Health Insurance Scheme, which is one of the ways of financing health in a situation where we don't have sufficient budget. Unfortunately, just about less than 10% of the population is covered by National Health Insurance Scheme. What happens to the 90%? There's a slogan, they are presently at the World Health Assembly now, and the slogan there is health for all. The vulnerable group must not die. We must bridge the gap between the rich and the poor because they cannot afford to pay for health care. We want to reduce spending out of pocket, which means you need health care and you need to go find the money wherever you're going to find it. So I think it is high time the government fulfill their commitment to the Abuja Declaration and make sure they allocate 15%. And this must also scale down to the states. It's not just at the federal level. States are expected to also have the health insurance scheme. For example, we just have about 10 states that are already have the health insurance scheme for now. Lagos State is about to start one. And if that is in place, obviously, it's going to be better.
And from all indications, we are far away from reaching the 15% that was agreed upon during the Abuja declaration, because if you look at from 2001 until now, it's only in 2012 that the percentage was raised to just 5. So we are far away from achieving the 15%. But beyond that, what is at issue at the moment is funding of the sector. Is there a way that public-private partnership can work in the area of helping to fund this sector?
Yes, that's great. That's where the health insurance scheme comes in. But I want to also say, at times, even when they allocate the budget, is it released on time for them to implement projects? No. And that's really affecting. And that is why the health insurance scheme, which has been introduced, and we, CSOs, civil society organizations, are really lobbying to see it start as soon as possible in many states. It's like we need to lobby and let states, because the primary health care is being taken care of by the states at the LGA level. The states must be able to gradually increase the health budget. For example, Lagos is doing 8%, which is quite good for now. And then we now also have to lobby that even though you have allocated whatever you have allocated, is it released on time for the ministry to execute projects? It's far from that. Now we are looking at how we can work with the private sector, philanthropists, donors, to contribute to that fund so that the vulnerable group can have access to health care. And of course, the out-of-pocket spending for health won't be there. For example, there was a case of a lady that was brought to my attention, and they realized she's going to have complications during delivery, so she had to go to CS, cesarean section, and she needed funds to do that. This is like somebody, I heard the story, the husband drove her away, and she doesn't have money to even pay for any bill. So they had to go around lobbying and see how we can make some money, and we donated the money. So happy, this happened just like 3 days ago. She actually delivered safely in the hospital, and they were able to use that money that was raised for her. For example, if there was nobody to help her around, she would have gone to the TBA, and she would have gone there, and I'm sure she would have had complicated delivery. Because we realized the baby was 4.8. That was like close to a 2-month-old baby.
A really big child.
So that's what we have around. People are dying. Women are dying. Mortality rate is very high.
In terms of all this lobbying, whose responsibility is it to actually negotiate a better deal for the health sector? Yeah,
it's actually the Senate, the House of Assembly. Another area of funding. Well, I'm happy our senators are trying. Yeah, we have the chair, House Committee on Health, Honorable Ted Joshua. I'm sure he pushed for the increase in health budget, and also they have this 1% consolidated fund, which they're supposed to allocate to health. He pushed for it, and then that is happening now, which is good. But beyond that, even when that money is allocated, is it, like I said, is it actually released for them to implement projects? And even this 1% that was approved that people are happy about, the issue now is the government must assent to it, he must approve it, and even after that, the money must be released. So the Senate will have to do more work, civil societies must do more work, the media must work with us to keep on talking. We need to save women and children, we need to reduce mortality rates, we need to have a healthy nation so we can have a healthy country.
After all, that's most important to citizens.
Yeah.
All right, Program Director, Child Health Advocacy Initiative, Lola Alonge, we thank you very much indeed for coming to share your thoughts with us, as always.
Thank you for being here.